Prenatal vitamins. Most women think that they can take any prenatal vitamin and they're going to be covered, have everything they need. That is not true because not all prenatal vitamins are created equally. Not all of them are the same, and different women actually need different things. We're not all the same, right? Hi, I'm Rachel Moises from the Mighty Mama Movement, a mother of 8.
And I'm Heather, a family nurse practitioner and midwife.
And if you're pregnant, you're probably wanting to ensure that you have the nutrients in your body that you need to develop a healthy baby, right? That's a huge thing. We all want to provide our baby with the best start in life. So we're going to talk about everything you need to know as you choose a prenatal vitamin or other supplements that you may need to take that aren't included in sort of a standard prenatal vitamin.
So let's talk about what makes a prenatal vitamin, at least in the United States, okay? So the big things that make a prenatal vitamin are having iron in it and having folic acid or folate. In some countries, iron is not the primary focus, it's iodine. So we are talking basically the United States here when we refer to it. New Zealand's going to be a little different, UK, other countries. So let's just clarify that right off the bat first.
So other than that, it's basically a multivitamin.
Right, with
the iron
few things added in.
Okay, so what are the key nutrients that pregnant women need to be really careful and ensure that they are getting enough of?
Okay, so the first one is folate. Many times it's called folic acid, which is the synthetic form. It's the cheaper, more cost-effective. The reason why we don't want folic acid, we want folate or even methylated folate, is because of how it is broken down. About 40 to 60% of the population has a gene mutation called MTHFR. It's not a swear word, okay? MTHFR. And with that, we cannot break down folic acid. We cannot use it properly. But not only can we not use it, it blocks the receptor site that folate is there for about 2 hours. So when you eat that cereal that's enriched with folic acid, or that bread, most wheat, most flour products are enriched with folic acid, at least in the United States, then you block those receptor sites so that when you eat food items with folate in them, the folate can't get there. Why is folate important? It is important because it helps prevent spina bifida, which is the open spine in a newborn. And so the folate, if we don't have enough of it and we're deficient, our chances of a baby with spina bifida go up immensely.
Quick side note, if you are pregnant and you want to get that baby out with less pain, listen to this. I'm a mama of 8 and my first 3 births were excruciating. I honestly thought unbearable pain was just part of the deal. But everything changed with my 4th baby when Heather, the same midwife and nurse practitioner you see in these videos, taught me a completely different way to handle labor. I had never heard anything like it, and I ended up dilating to 10 centimeters with 0 pain. After 8 babies, I can tell you this method works. Most mamas never learn these strategies though. Even if they want to avoid an epidural, they worry they won't be able to. That was me. I had done tons of research, but I never found a real method that actually worked, just scattered tips. After learning this, I never considered an epidural again. That's why Heather and I started teaching this, because birth does not have to feel like torture. Our 10-step practically pain-free birth method has helped so many women, like Mumina, who said that her twin birth was way less painful than her first singleton birth because she used this method. If you're curious, click the link below and save your spot in our free online class, How to Give Birth with Practically No Pain.
And so look for, on your prenatal vitamin, does it have folic acid or does it have folate? Now, sometimes it'll say folic acid, and then in parentheses, it will say as folate.
Oh, okay.
And if you're unsure, because sometimes it'll say folate and then it will say folic acid. So you have to ask, is this folic acid or is this folate? Because it does make a difference. And that's where you have to do some research, call the manufacturer and find out. And I will tell you, I've called many manufacturers and to clarify, and I cannot tell you how many times when they use folic acid, they'll say, oh yeah, but there's not that big of a difference. And I'm like, this person is obviously very misinformed. I will not use their product. So this is what I tell my moms is that's the first thing you're going to look at is it folate or folic acid?
And the folate is really important early on in your pregnancy. I mean, really, if you're trying to conceive, you should already be consuming folate. But if you haven't started yet, just start now. But that's kind of an urgent thing. You want to start consuming folate immediately.
Exactly. And then the second one is the B12. We need B12. It helps us many things, but one of the things it does is help us to build our blood volume because it needs to expand in pregnancy to help with the blood flow for mom and baby and with our growing body and growing baby's body. So the B12 should be methylcobalamin, not cyanocobalamin. Remember, meth is good, cyanide's bad. Cyanide is what the old lady used to X off her husband. Okay. So I always think of these little tricks and terms, to remember. But you want methylcobalamin. If it says cyanocobalamin, it's synthetic, and your body may not utilize it as well.
Now we're telling you all these little tips so that you can check a prenatal that you're already using or try different ones. Some women, they'll make them sick, so they need to try multiple ones. We are going to link to one below that meets all of the qualifications. So if you're not using one or you just want to switch to one that does, you can just get that one. But we're going to go through information to make sure that everyone has the education they need to choose a good prenatal vitamin that works for them.
So the next thing is iron. When a very common iron to use is iron or ferrous sulfate, that causes constipation. We don't absorb it very well. Many women, it causes nausea, which is why they don't want to take any prenatal vitamins when they're pregnant. Iron should typically be taken on an empty stomach. And if it makes you nauseous, that is the last thing in the world you want to do. So you want an iron or a ferrous that is more gentle. So a chelated one, a glycinate, any of those, you can look up what it has and how bioavailable it is, how much you absorb, and the nauseous factor. One thing that's important, if you're taking a separate iron, you don't want to take iron within 2 hours of calcium. So either a calcium supplement or milk. You don't want to take iron with milk. You want to take iron with vitamin C. And in fact, if you take it immediately with vitamin C, so an iron supplement with a vitamin C supplement or orange juice or cranberry juice, something with vitamin C, you will have a much better absorption rate. And then take it as much as possible on an empty stomach without food. Now, sometimes being pregnant, you have to do what you've got to do. Exactly. But if you can find one that doesn't upset your stomach, then doing it on an empty stomach is best.
And how about plant-based iron? Is that better?
I love plant-based. I love plant-based the best. A good iron supplement should never be just iron. A lot of times physician offices will give you a prescription for an iron supplement. That is probably the worst iron. It's going to cause constipation. It's going to cause nausea. You're not going to have good bioavailability, and it's just iron. You want to supplement, like Hemoplex is one of the many ones out there. Dr. Christopher's has a great one that is iron and a good type of iron. And it has a lot of times B12 in it. It will have vitamin C in it. So it has a whole bunch so that because the reason, for instance, that we eat an orange rather than just orange juice is just the juice. It's missing out on all of the properties of an orange. Does that make sense? It's missing. And so the whole foods are the best. And so if we can combine iron with the properties that help it absorb, that's really good. And let me just say too, food, we want to have good foods, right?
Right.
And raw foods, fresh foods. But our foods have been severely depleted. An orange from the 1950s had way more nutritional value than an orange today because they have been farmed and the land has been depleted, the vitamins, the nutrients have been depleted. And so we truly do need supplementation in many cases because our food supply is not what it used to be.
It's not as nutritious as it was.
Exactly.
And when you're pregnant, these nutrients are so essential to a baby's development and to a healthy pregnancy, to avoiding complications, to feeling well. So it's just a time, if you're like, oh, I don't like to take supplements. I don't really take vitamins much when I'm not pregnant. I just try to eat a lot of healthy food. I don't know if it's enough or not, but when you're pregnant, it's a totally different story.
Exactly. Another supplement is, or a product in the supplements, is DHA. This helps with brain development of baby, and we need to get basically those good fats that our babies need for development, and we need them too. Our brain needs fats, you know.
DHA can help reduce postpartum depression and things if you're taking that.
Very, very important. There is choline. It helps with the developing fetus and that growing of it. We add a few more things to the supplementation. Now, some prenatals will have vitamin D3 and K2. They work together, kind of like the calcium, and you combine all of these to make a good supplement in the absorption rate. Well, you really need these different supplements. Vitamin D3 and K2 help the development. K2 makes it so that we don't pull calcium from our bones. And so that combination they have in your prenatal. Most prenatals have a very low number of vitamin D3, and we put our moms typically on a high dose of vitamin D3 because so many people, in fact, I can say with pretty much confidence, every single person that we have ever tested that does not regularly supplement with 2,000 to 5,000 units of D3 on a daily basis for quite a while meaning being a year or more, is deficient in D3. And
deficient.
it really is.
And must be.
Vitamin D does not pass through breast milk until your blood measurements equal 80. So you'll see a lot of things that say, oh, vitamin D doesn't go through breast milk. It absolutely does. It's just almost nobody
has high enough level
for it to pass through.
Okay.
Exactly. And so for us, we put our moms on a separate high dose of vitamin D3, and you can talk to your provider about that. I am going to be honest though, most providers do not have a good knowledge base on supplements. So you need to find somebody who is very educated, and that may be someone other than your OB because their specialty isn't supplements. Their specialty is complications of pregnancy. It is not nutrition of pregnancy. I promise you, your OB and even a lot of midwives, especially certified nurse midwives, did not get very good training in nutrition. How do I know this? Because I've been through school. I know. And it took a lot of additional education for me to get what truly is needed in supplements and which ones are good and which ones are bad, because it was not in my medical training at all. Another one is probiotics. There are a lot of prenatals that include probiotics nowadays. We are finding in our area that is great, but the probiotic in the prenatal is not strong enough to prevent group B strep, which we talk about in another video on group B strep. And group B strep, just a quick rundown, is a bacteria in the intestines that if it overcolinates can cause severe problems if baby were to catch that in its birth. And so we want to prevent group B strep. It must be a separate probiotic, and you have to take that for months before baby is born. This is not something you can start at the end. So we start our moms at the very beginning now on probiotic. We have a few different ones that we use, but a good probiotic that will really help with killing off group B strep. But it's not just about group B strep, it's the gut-brain connection. Our gut affects our moods, our digestion, the absorption of our foods and our vitamins and our nutrients. It affects the health of our body. It is everything. And if you have been on antibiotics lately, in the past year, you must be on a probiotic. So that is something that is in some prenatals, but we recommend it extra on top of that.
Okay.
So that's one of the many things. What other things have you taken extra in your pregnancy that maybe wasn't in the prenatal vitamin?
Magnesium is really important. Did we talk about that? We talked about it in another video.
Yes.
You guys, you got to just watch all of our videos because there's so much to learn about pregnancy and we can't repeat everything in every single video. Magnesium is really important. We were talking about it in our video about headaches. It can help with that, but it helps with a lot of other things. So that's one that you do want to make sure that you're getting magnesium.
Definitely. Calcium, making sure you're getting enough calcium as well. Once again, don't take your calcium with your iron at the same time. But prenatal vitamins, a lot of times, and in most instances, vitamins, nutritional, prenatal, multivitamins, they contain the minimum you need for survival. They don't contain optimal doses. And so that's why, even though a multivitamin may be really good, it's the minimum you need for survival. You need a lot more nutrients depending on your lifestyle, where you live, all of those sort of things. And so having those extra supplements like magnesium, you might need a little more to get your bowel movement going and
to rest well.
Yes, in the summer, you think, oh, I don't need vitamin D3. Well, unless you're a farmer working out in the fields constantly, if you're wearing a lot of sunscreen, we just don't get enough in the summer. We just don't. And the more north you live, the summers are shorter compared to someone who lives in the south. They're going to get more sun exposure, but are they really? Are they inside? Are they wearing a lot of sunscreen? Are they avoiding the sun? What's happening here? So we really need to up many of our vitamins that we haven't had to up in the past very much. And they're so protective. Making sure we get the right vitamin, which we've been talking about, making sure it's a good brand and that it can be absorbed. Not trying to make it super complicated, but it's not as easy as just going to the big store, buying, oh, this one looks good. It says prenatal on it.
It's cheap.
Right. So I'm going to get it. In fact, a lot of times, the cheaper it is, the less your body is absorbing it, and it's just expensive urine.
Yeah.
That's what it's, because you just pee it out.
And like we said, during pregnancy is a time to prioritize certain things. If you don't want to take vitamins for the rest of your life, that's fine. But during pregnancy, it's a different story. And I just want to point out, we're talking about this, the topic of this video is vitamins and supplements. We're not saying that nutrition isn't important here. Okay, that is a whole other topic.
Oh, yes.
Is good nutrition to have your foundation and your baseline and helps so much with health. Okay, it's just not the topic of this video, but yes, we understand that that's the foundation and that's where you start. These are supplements that are in addition to good nutrition. And especially if you don't have good nutrition, it's even that much more important.
A lot of people will say, oh, baby will just steal the nutrients from you. But if you were already deficient, there is no D3, vitamin D, for baby to be able to steal from you. If you are deficient in iodine, baby needs your T4 to cross the placenta to supply them so they can make their own T3, which is vital in their development, in the placenta's development. But if you don't have enough of it, baby has none to steal. So you have to make sure that your levels are high enough in these things. And especially if you have children back to back, or you had a surgery before pregnancy or some sort of severe illness, you're not going to have those nutrients to steal. And if you don't have those nutrients for baby to take, then that's where you have a higher rate typically of preeclampsia, preterm labor, a lot of these complications that can happen because, well, we just need a lot of nutrients to grow a baby.
Yeah. And then there's also the fact, you should remember, you're creating a brain,
yes,
a liver, a heart, an entire cardiovascular system, bones, your body has to make the baby out of something.
Yeah.
Right. And so it's just so essential to set your baby up for a long-term success in their health the best you can. I mean, not everything is avoidable, but the best you can by getting sufficient nutrient of the things that we're talking about here. So Heather, is there a difference between gummies, capsules that you swallow, the hard pill ones, prescriptions? Does it matter? like how the format of the vitamin, liquid
right?
vitamins.
The binders can make a difference. So there are some vitamins that the gut can't break down, which can be a good thing and a bad thing. For instance, a lot of times with probiotics, we don't want them destroyed by the acid in the stomach. And so we want it to be able to continue on to the intestines and be able to bypass the stomach in many cases, not all of them, but in many cases. And so the binders or the protective capsule or coating that can be used can make a difference. But then there are some that the stomach can't break down. And so they're broken down later on, but they need it absorbed in the stomach.
It's breaking down a little too late.
Right. And then in pregnancy, you go one more step. There are some that are so hard on the stomach that they make you nauseous. You end up throwing it up or you can't take it anymore. And so capsules can be good in some situations because it is better absorbed and less nauseating. We have a probiotic. We have a few different probiotics that we sell, and one of them is in powder form because the man who created it, his child had cancer and she couldn't swallow pills. She was too tiny. She was very small. And so he did a powder form. He was a chemist and found wonderful without preservatives and dyes and all this. And it tastes very good. And so if I tell a mom, if you cannot handle one more pill, let's do this probiotic for you. Some women like the gels, some like the capsules. And I'm afraid to say that in pregnancy, sometimes you take what you can keep down.
Yeah.
That's
especially early on, if that's.
Exactly. Like I know for me, when I was pregnant, I could do like gummies, chewables. I could not do a pill. I would throw a pill up almost every time. And so I had to do a children's chewable, and then I had to find other supplements to replace it because a children's chewable doesn't have enough.
Right.
But that's what my stomach could keep down was a children's chewable and gummies. I know for me, magnesium, I do either through a powder or through a gummy. I found that I have better results with that than if I were to take a hard magnesium pill. My body just doesn't break that down very well. So sometimes you can really tell. Iron is one. If you are taking an iron supplement quite diligently and your levels aren't going up, you either need to change the product that you're taking or you need to add more vitamin C or a different type of vitamin C to it. So it's not always, sometimes it is the delivery system and sometimes it's what's combined with the delivery system that can make a difference.
All right, we hope that helps you navigate. I know there's so many options out there and it can be confusing and overwhelming, and what do you need? One thing we didn't mention yet is that getting a full blood panel at the beginning of pregnancy is really helpful in knowing if you are specifically deficient in anything, and that can help. And we do have another video that talks all about the blood work that you should be doing at the beginning of pregnancy. So watch that if you're just kind of thinking, I want to go minimal and only what I absolutely need. But everything that we said is pretty essential for pregnancy. And then remember that we do have a free online birth class, How to Give Birth with Practically No Pain. So you may want to check that out.